Mr. Chairman, I just want you to know the Trump administration fired many of the CDC port health station staff. In fact, at SeaTac in my state, there used to be 4. They are the person that screen travelers at the ports of any entry. So if we don't have people there to screen, even a mandate would make it very difficult to assure that. So I share your concern, but I also think we have to have personnel there to do it. With that, Mr. O'Neill, we know right now that at HHS they're undertaking a massive reorganization, firing staff, canceling and terminating thousands of grants and contracts worth billions of dollars, delaying sending that grant funding out, including, by the way, for life-saving biomedical research. And meanwhile, HHS is currently, and I know you're not there yet, but they are refusing to provide basic answers to many of our straightforward questions. They are canceling long-standing briefings, and they're telling Congress and virtually the American public nothing about these dramatic, unprecedented changes. Last week, HHS submitted an operating plan for fiscal year 25, required by law, and it leaves it blank. The funding levels for 530 programs were left blank. The department is effectively telling us it doesn't have to tell us or the American people anything about how it is going to spend tens of billions of dollars, taxpayer dollars, across hundreds of programs, and that is really stunning to me. In my time in Congress, I have never seen an administration less transparent than this one. I've also never seen an administration so insistent on pretending they are transparent while going out of their way to hide basic information that we require. So, Mr. O'Neill, I want to ask you, if you are confirmed, will you commit to prioritizing real transparency and sharing information with Congress and the American public about what HHS is doing?
Thank you for the question, Senator. It's lovely to see you. I was a Senate staffer in the 1990s. We had a few pleasant interactions I don't expect you to remember. But yes, I have a kind of visceral sense that it's Congress that authorizes all the programs at HHS. It's Congress that appropriates the money for HHS. Congress absolutely deserves to have prompt and accurate information, both proactively about future plans and also in reply to questions, whether it's testimony or written questions. And yes, I commit, if confirmed, to ensure that the whole department takes seriously its obligation to provide good, transparent, accurate, prompt information to Congress.
Well, I appreciate that answer. I'm not holding my breath because I haven't seen it happen yet. But, Mr. Chairman, I want you to know I am focused on real transparency here. This department is not above congressional oversight. And we have a responsibility and need to hold all the agencies accountable. So this is something I'm tracking very closely. I wanted to ask you quickly, too, about women's health. The plan to gut HHS is a disaster for health and safety, but it is based, it seems to me, on a total lack of understanding about how different agencies across the department work. For example, Senator Kennedy seems to think we shouldn't have more than one office that covers women's health. Well, women's health requires dedicated focus in different areas. For example, workforce training at HRSA, cancer prevention at CDC, scientific research at NIH. Those are separate and distinct efforts addressing women's health, which has long been underfunded. But because of Congress's dedicated bipartisan investments, we've been able to make progress. So if you are confirmed, will you commit to restoring women's health functions across HHS and directing the department to spend an appropriated funds for women's health as directed by Congress?
Thank you for the question, Senator. Obviously, women's health will continue to be a critical issue. It is distinct from men's health in many significant ways. The principles that the Secretary outlined for the proposed reorg said that any reorg would be based on preserving all essential functions of the department, ensuring that they continue and that they're executed on well, as mandated by statute. And also the principle that if two functions make more sense to be conducted within the same agency or office, that could make sense. It also makes sense to me that if functions are closely similar, perhaps we should consider putting them in the same office.
Well, I would just say, Mr. Chairman, women's health isn't just one little corner. We are affected, women are affected by many different ways, including, as I said, through workforce training, through cancer prevention, through scientific research, different agencies. Those offices all do very different things. There's a reason why Congress passed funding for each one of them. Ignoring that means ignoring the law. Thank you, Mr. Chairman.
Senator Moody.
Thank you, sir. Thank you for being